The major disadvantages would revolve around misinformation, ethical concerns, and potential harm. Disadvantages of a 3D doctor smoking. Prompt 1. Medical misinformation and trust erosion. Contradiction of health messaging. A doctor smoking directly contradicts decades of established public health warnings. If a 3D image or AI-generated content, the prompt result, presents a doctor, a figure of medical authority engaged in a harmful behavior like smoking, it severely undermines anti-smoking campaigns and essential health advice. Normalization of harmful behavior. It can unintentionally normalize smoking, especially for younger or impressionable audiences, suggesting that if a doctor does it, it can't be that bad. Erosion of professionalism. It damages the professional image and credibility of medical professionals by associating them with a dangerous habit. 2. Ethical and legal issues for the doctor image. Violation of professional ethics. Most medical associations have strict ethical guidelines regarding personal conduct and public perception. Depicting a doctor smoking could be seen as a serious breach of the do no harm principle in a symbolic way. AI bias and misrepresentation. If the 3D doctor is generated by AI from the prompt, the resulting image might inadvertently reinforce harmful stereotypes about doctors, a specific demographic, or cultural groups if the training data contained bias. Misleading educational content. If the image is intended for educational purposes, e.g., to warn against smoking, the contradictory nature of the subject, a smoking doctor, would make the message confusing or ineffective. 3. 3D disadvantage in medical imaging context. If you're thinking about the term 3D in the context of medical imaging, like 3D CT scans, increased diagnostic errors. Some studies have shown that human observers, like radiologists, can sometimes be less successful at finding small objects in 3D image stacks compared to 2D images, a phenomenon sometimes called the three-dimensional disadvantage. Source 1.5. They may underexplore the data set due to the time commitment. Higher complexity, creating and reviewing high-quality 3D models or visualizations takes more time, computational resources, and specialized training than 2D images. In summary, the primary disadvantage of this kind of prompt is the damage to public health messaging and the ethical dilemma of creating an authoritative figure endorsing a known killer.